Okay, so work of breathing. Okay, if you took high school physics, you know that work is force times distance. And the equivalent of this in the respiratory system is pressure times volume. Okay, so we have our pressure volume curve. Okay, we talked about the static compliance curve. That's this black line is the static compliance curve. Okay, so to inflate the lung from this position up to this volume, we do a work against elastic recoil and surface tension, roughly equivalent to this blue hashed area. Okay, so it takes a certain amount of work to inflate the lungs, and we're working against elastic recoil of the lungs, the chest wall, and surface tension. Okay, now that's our static compliance curve, but we breathe continuously. We don't, Anyway, so we have to actually look at a dynamic compliance curve, so that's this red curve. Okay, and this is measured during breathing. And this curve bulges out from the static compliance curve, and this red area shows additional work. We still have to do the same work against elastic recoil, but in addition, we have to do work against airway resistance. Okay, and so the additional work against airway resistance is red. The total work would be the red plus the blue. Okay, if we breathe faster, okay, then we have the green curve, and we do even more work against airway resistance. Okay, so depending on how quickly you breathe, you are going to, the work will vary somewhere between what we had from the static compliance curve and the whole thing altogether. Anyway, this is just a cartoon, but it's kind of, okay, so work of breathing. It doesn't feel like it takes a lot of work to breathe, although if you had emphysema, you might disagree, but it usually doesn't seem like it takes much work, and this is actually true. So as you're sitting there, you're consuming about 250 milliliters of oxygen per minute. Kind of amazing, but anyway, so what fraction of that is work done by the respiratory muscles? Well, only about 3 milliliters, so roughly 1% of the oxygen that you're consuming at rest is due to the work of the respiratory muscles. Okay, well, that's not very much, but if you increase ventilation, you increase the work done. Okay, and we're measuring work in terms of the rate of oxygen consumption, and so we're starting at 250, which is pretty much all the rest of your body, and then anything added in this curve is work purely by the respiratory muscles. Okay, and so you're just sitting there and you're hyperventilating, and then you measure how much work this involves, and you can increase your ventilation roughly 20 times over resting values. Okay, and this is useful when you're exercising or running away from a lion or things like this. Okay, and so when you do increase your respiration, you can see that now the respiratory muscles are consuming, let's say, 600 milliliters of oxygen per minute. So this is, the respiratory muscles are now consuming more than the rest of your body combined. Okay, so that can become significant. And it's especially significant in a patient with emphysema because due in part to the increased dead space and to the problems they have with expiration, they have to do a lot more work to increase their oxygen intake. And so any additional work, any additional breathing at all involves a fair amount of work. Okay, and so with a small amount of exertion, they may be using all of the oxygen that they're breathing in just to power their respiratory muscles, so they don't have any oxygen left for doing anything else with the rest of their body. Okay. This table is a little bit like the one that we looked at before. We have the rate of breathing and the tidal volume, so we're looking at different breathing patterns. But now instead of keeping the total minute ventilation constant, we're keeping the alveolar ventilation rate constant. Okay, and so this is the alveolar ventilation is the effective part, and so we're saying, okay, if your body needs 4 liters of oxygen per minute or 4 liters of alveolar ventilation per minute for metabolism, how are we going to accomplish this? Okay, and so we can breathe 5 breaths per minute with a tidal volume of 1,000 milliliters, or we can go all the way up to 50 breaths per minute with a tidal volume of about 200 milliliters. Okay, and what we're looking in the last 4 columns at is what's the work of breathing in these different ways. Okay. Now, I will mention that the anatomic dead space here is not constant. It changes a little bit, and the reason it changes is that with 5 breaths per minute and a very large tidal volume of 1 liter, when you breathe in a whole liter of air, you've expanded your thoracic cavity, you've stretched the airways to a larger diameter, and so you've actually increased the amount of air that goes into dead space. Okay. But when we do these calculations, for example, on the exam, just assume dead space is constant. This is kind of a relatively minor point, and there's less than a 2-fold difference in the whole range, but this is, yeah. Okay, so it's hard to look at columns of numbers, so I've plotted the last 4 columns on a graph, and that's shown here. Okay, so first we have work done against elastic recoil. That's these diamonds, okay, as a function of the breaths per minute. This is the different breathing patterns. Okay, and what we can see is that as we go to less frequent breaths per minute, or more importantly, larger tidal volumes, the work done against elastic recoil increases. Okay, if you think about the pressure volume curve for the lung and chest wall combined, it's steep in the middle, but at the lower end and at the upper end, it flattens out. Okay, so the compliance is greatest with small normal tidal volumes. If you have a very large tidal volume, the compliance is less, and it takes more work against elastic recoil. Okay, so the very slow breathing pattern is penalized by the fact that you have to do a lot more work against elastic recoil. Okay. Now, the next 2 columns show work against airway resistance, and these are divided into laminar flow and turbulent flow. Okay, so if we look at this point, we have to do this much work, looks like about 16, against laminar flow, and then 3 or 4 extra against turbulent flow. Yeah. Talking about the elastic recoil work? Yeah. Okay, so yeah, so with these higher breathing rates, the tidal volume is really not changing very much. 206, 220, 260. Okay, pretty small changes, and so there's the small increase in work against elastic recoil, but not very much. And this is also happening in the kind of efficient part of the curve. And so you're doing a little more work against elastic recoil, but then you're breathing less often. And so it kind of works out this way. But it's when you get up to this between 10 and 5 breaths per minute, you double the tidal volume, a huge increase. And that's why you get this large increase in work against elastic recoil. Yeah, well, I mean, you certainly could, you could do that. I don't know how I would put it on the graph because this graph is based on keeping the minute ventilation constant. But I mean, you're asking why this is nonlinear, why it kind of levels off here? I mean, I'm not exactly, I don't think I'm understanding the question. Maybe you can come afterwards and, yeah, okay, thanks. Okay. So work against elastic recoil is greater with low frequencies and large tidal volumes. If we look at work against airway resistance, this increases as we increase the breathing rate because we're forcing the air through the airways at a higher rate, okay? And another factor is that with shallow breathing, to maintain alveolar ventilation, we have to increase the total minute ventilation. So we're moving the air faster and we're also moving more air. So a high breathing rate pattern gives us more work against elastic recoil. And so this would be the total work against airway resistance. Okay, so the total, this is against turbulent flow, this is against laminar flow. And the turbulent flow becomes more significant at high breathing rates because turbulence occurs if you move the air more rapidly, and that's what you're doing at higher breathing rates. Okay, so work against elastic recoil is highest at low breathing rates. Work against airway resistance is greatest at high breathing rates. The total work is the sum of all these, that's the black squares. Okay, and the work is higher at low or at high breathing rates, but it's minimized kind of in the middle. Okay, and where the work is minimal is at breathing frequencies, which are what people normally breathe at without thinking. So say 15 breaths per minute. Okay, so this is another example of how without thinking about it, you automatically breathe in a way that minimizes the amount of work that your respiratory muscles have to do. Okay. So this is our normal work of breathing for different breathing patterns. If we have restrictive disease like pulmonary fibrosis, it's hard to inflate the lungs because there's extra tissue growing within the lung parenchyma, and with a maximal inspiratory effort, we can't achieve the same total lung capacity of a normal person, okay? So we're having to do more work against elastic recoil, and so the result is that the person with restrictive disease has more work at low frequencies where the work is mainly against elastic recoil, and the minimum work occurs at a higher frequency range than in a normal person. So a person with pulmonary fibrosis will probably breathe at a higher than normal rate and maybe with more rapid, shallow breaths. And they do this because this is the most efficient way for them to breathe. This minimizes their work of breathing. Okay, now a patient with obstructive disease, their problem is moving air through the airways. The airways are obstructed, and so at high frequencies where they have to move air faster, they have more problems, and so they have extra work at high frequencies. So their optimal breathing rate will be a little bit lower than a normal person. So someone with emphysema will tend to take slower and deeper breaths. Okay, so everybody tries to minimize the work that they do. Reasonable enough.